start. It's very dark.
It's fine, Daddy. It's fine.
Don't tell me the other.
It's not dark. It's just the.
Bring it a little bit closer. Not that far.
It's fine, Daddy.
Stop saying relax, okay?
You need to relax.
Stop saying that. Okay, can we start? You guys have everything ready to start?
Yeah.
Tell me when we're ready to start, everybody. Let it be quiet and be sat myself. My mic's not live. I'm waiting for a signal. I'm not going to talk anymore, just waiting for a signal. Agree? Somebody?
Okay, so just.
Good evening, everybody. Today, we are pleased to once again have our broadcast. The objective of the broadcast is to ensure that we are able to keep in touch with our constituents and to answer any general questions that may arise or things that are of just general interest. This evening, of course, the advertisement was for us to interview Dr. Carika Weldon. Unfortunately, she is not able to attend this evening, and I just spoke to her. The reason is because she has to complete some testing, and she's also preparing for the government broadcast that will occur at 8 o'clock with the Premier, Minister of Health, and the Chief Education Officer. However, because we know that there were so many persons that had intended to view, we didn't want to cancel the broadcast completely, and instead we'll provide some information. And of course, Dr. Weldon sends her sincerest apologies, and we will figure out a next best time to have her on the show and to have her talk scientifically about the COVID-19 virus and the vaccine, which is soon to be introduced. What I will do, though, is highlight what the Minister of Health did on Friday, which is to give an update on where we are in Bermuda. And the main thing I want to do tonight is to ensure that all of us take the current situation in Bermuda very, very seriously. We have seen that there are some, what I want to classify as irresponsible posts in terms of let's not wear masks and do some other things, but clearly that would be unacceptable. And as I said, it is irresponsible given where we are now, because with the increased prevalence of the virus, the government, the Premier and his cabinet team and others will be forced to make decisions that we don't want. The Premier has already emphasized the fact that he doesn't want, of course, to close Bermuda down, doesn't want to have to close the borders, and doesn't want to get to a stage whereby we deny persons coming into the island, because that will have a significant impact on the tourism industry and all of those that are employed in restaurants, hotels, and other ancillary services which depend on guests coming to Bermuda. I just want to read a short part of what the minister spoke to on Friday. And as you know, that the House Assembly now occurs each Friday, and at that stage, the government ministers will bring to the public attention certain information that is deemed to be important. In this case, the Minister of Health brought her statement on Friday, which talked about the public health guidance given for December 2020. I'm not going to read it all, but the main thing I wanted to highlight is the fact that there is going to be an increased emphasis on those persons that are returning to Bermuda, both visitors and residents alike, because we need to be sure that the virus is contained as best we can. Persons know that right now, Bermuda does have what's been described as one of the most stringent testing protocols when it comes to COVID-19, in terms of anyone coming to the island must have except for residents, they must actually have a pre-test and then get a travel authorization. And then once they're on the island, if they're here long enough, They'll be tested upon arrival, tested on day 4, day 8, and then day 14 before they are completely free of testing and can roam the island completely free. And so the emphasis has been to ensure that all of us really take this serious. There is no time for us to play. As the Christmas season approaches, we have to be very careful that we actually govern ourselves so that we are mindful of the guidance given by government. We're also mindful, of course, about our desire to celebrate, but we have to be responsible. And I can speak from personal experience in terms of my family Christmas celebration normally involves everyone getting together, which could range anywhere from 20 to 30 people in one physical location. You have dinner, have dessert, discussions, talks and fun times, open gifts, whole 9 yards. But for this year, we have had to significantly consider scaling back and possibly canceling or postponing it because there are several persons in our family who are seniors. There are others that have different characteristics which make them vulnerable. And yes, while we may want to celebrate, it clearly does not make any sense to cause persons undue risk and bring them all together. So therefore, notwithstanding the attempt to have the physical distancing, because we are from various households, it will not be wise to bring us all together, even if we wear masks. And so the goal or the intention is probably going to be to postpone that. We may have a Zoom type dinner as we try to adjust to the new reality, but clearly it doesn't make any sense to put persons unnecessarily at risk. And so that's going to be the encouragement for everyone, and my encouragement especially to those persons who are in constituency 7, Hamilton South. As I said, the goal of these broadcasts is to keep those persons informed and to ensure that we're able to reach out to them. And we've actually received some questions which I'll answer those which I think I am able to do so, but clearly I'll defer those questions that directly relate to the scientific elements of the virus and the vaccine that Dr. Weldon would have addressed. The general comment in terms of the vaccine that I know I can answer is that persons have asked, and I can answer this because the minister has advised that the Bermuda government will not require the vaccine to be mandatory. So we're not going to force persons to be vaccinated. What we will do, of course, is to encourage persons to be vaccinated based upon the vaccines that will be introduced. And the government has already said that they will have access to various vaccines provided primarily to the UK government and otherwise. But the goal, again, is going to be to work through encouragement as opposed to making it mandatory, because there is some restrictions, I want to say, imposed by the fact that Bermuda does have a constitution, and notwithstanding the significance and the seriousness of the virus, we cannot go and contradict or contravene the primary elements of the Bermuda, well, we call it for tonight the Bermuda Constitution. So let's be very, very mindful of that. One of the significant elements for all of us, though, is that whilst anyone might choose not to be vaccinated in Bermuda, there is the thought that some of the countries to which you would like to travel might require evidence of a vaccination prior to you being able to enter into those countries. And so if that's the ultimate imposition by those outside countries, we will have to make decisions in terms of we may not want to be vaccinated, but then that's also going to mean that we're not going to be able to travel. And so for many of us, that's going to be a difficult decision. I also want to emphasize, again, for those persons that have primarily students returning for the Christmas vacation, the government has given significant advice in terms of there needs to be self-quarantine. And just today, I was actually at the airport and a student did return, and I took the opportunity to ask her and her mother what their plan was in terms of ensuring that they're able to comply with the guidelines. And her response was that her mother had made arrangements already to obviously pick her up, make sure she wears masks and what have you, and then she would ensure that her daughter is able to be set in her room primarily and away from everyone else, and that will then allow them to comply with the government guidelines. And so she would be in a self-quarantine status, which is what's going to be very, very important to ensure that she does not invariably or unintentionally spread the virus. And the example there is going to be, again, relevant for many of us now, is that as a child comes back from university for the summer break, there needs to be a serious recognition of the fact that if it's my daughter, for example, and she comes into my house and we are intermingling, that I, as the father, as the person doing the work, I cannot then go out to work because there is a significant risk of me contracting the virus from my daughter unbeknownst to me and then passing it on as I go to work. And so the significant guideline now is that my daughter, when she comes back, if she's not been tested before she arrives, she'll be tested when she arrives, and then again on day 4, day 8, and day 14. But the reality is, me and the entire family that is not able to properly separate from her, should actually stay home also, so we don't, again, go into the workplace and cause the unnecessary spread of the virus. And again, we do have several questions, but I'm not going to obviously attempt to answer them because I do not have the scientific background, and we want to be very careful that we do give factual information as opposed to what people think of, because clearly if we give information that is wrong, we're going to cause persons to have wrong information and do things which are going to cause more of a concerns to all of us. So what I will do actually, because I know that not everyone listens to the House of Assembly on Fridays, is read a portion of the minister's statement. And again, it was given on Friday by Minister Wilson. I'm only going to read it now because I know there are persons that are listening that would not have listened on Friday. I'm going to skim it to highlight certain points. So in terms of what the government has done, the highlight was that visitors to the island support hotels, restaurants, bars, and taxis. They participate in a variety of experiences and visit the diverse attractions the island has to offer. They rent mini cars and mopeds, and in general, provide an invaluable boost to our local economy. In short, visitors support jobs. That statement goes to support the fact that to close the borders will have a significant impact to those elements of the economy, which then means that persons will be impacted, which would be a negative for all of us. Having said that, of course, we do recognize that healthcare is primary, but we the government, have to be very careful in balancing those two aspects, healthcare versus the economy. And so recognizing that it is travelers, both visitors and residents, who, despite their best intentions, are likely to import the coronavirus, the Ministry of Health has developed a number of public health protocols to combat and minimize the possibility of infectious spread. These protocols for travelers in public places, which is streets or parks, when other persons are present, and 6 feet distance cannot be maintained. So again, gotta be very careful in terms of making sure that to the extent that we're not able to be physically separated from others, that we wear the mask. These masks are very, very important, and it's important that we wear them at all times when we are in contact or expected to be in contact with other persons. And what I want to do, obviously we're going to have a shorter broadcast than normal tonight because Dr. Weldon, as I said, is unable to attend. Just want to look for some of the questions that are here, so that people would know what types of questions are being asked. I'm just gonna go back to technology and just read some of these questions so that people know what types of things are being asked. Yeah. Okay. One question that has been asked is, why are we allowing Bermuda travelers returning home to the household and not ensuring that the entire household quarantines? I get that some folks have jobs and they cannot work from home, but then the traveler will have to quarantine at a hotel or Airbnb. The reason why we are able to slow the spread before us because Bermuda residents were put in a hotel. And that speaks again to the idea that when a student returns, the family must understand the degree to which they can or cannot self-quarantine. And if they can't, as I said earlier, the entire family should remain at home and make ultimate or alternative arrangements for things like groceries and what have you, so that we maintain as best we can, we minimize rather the spread of the virus. The one thing that we can take comfort in is that the local testing regime is actually very, very good. In my professional role, I work at the airport, and I know that we are constantly commended, Bermuda's commended for the fact that you can come in, get tested today, for example, and we always advise that results will be given to them within 24 hours. And very often, as a commendation to the entire health team, including Dr. Carika and her team at the lab, they're able to give those results back overnight. And so if they were tested today, the chances are they'll receive the results via email at some early stage. And so in that regard, Bermuda is almost head and shoulders above the rest of the world. And so we again have to commend everybody, but at the same time, encourage persons to be very patient, because we are now having to conduct more and more tests on a daily basis almost. And so the volume may cause the timing to slow a little bit, but as far as I'm aware, we're still being very consistent in getting the results back to everyone. And as I said just now, I am always receiving comments about how appreciative visitors are to the island, because they're able to get tested and get the results in a very timely manner, and thereafter be able to enjoy Bermuda. There are some comments and questions also in terms of what is the actual content of the vaccine. Clearly, I'll not answer that because I have no expertise and I wouldn't want to give out the incorrect information. There's a question in terms of what are the long-term effects of the vaccine? How long does the vaccine protect the person after injection? What if the vaccine is not kept cold enough? And what if I get that batch? Yes, there is a requirement for the vaccine itself to maintain a certain temperature. But again, Dr. Weldon will have to address that. What I do know is that even when samples are taken, because we do provide a service that does that, that the samples after taken must be maintained in a cold status until they get to the layer. Otherwise, the samples themselves are not valid. And so we always make sure that they are maintained in a cold status prior to getting them to the layer. As I said just now, another same question actually, but from a different person, is what is the makeup of the vaccine? Another one is there's been lots of speculation and conspiracy theories around the content matter of the vaccines. Can that be clarified? What I can say in that regard is that yes, whenever these things arise, there are persons that will always advance different arguments, and sometimes they go to the conspiracy elements. But what we need to do is, as I always say, is listen and trust the science. I do know again that there is a significant element of professionals that are given guidance and comment in terms of what we do with COVID-19 in Bermuda, the vaccine and all the rest of it. And I always encourage everyone to be patient, trust our professionals, because clearly no one is going to give out intentionally incorrect information. And we have a very good health system in Bermuda. And so trust, be patient, and then follow the guidelines. And I think we'll all get to a better state. The other question is, where can the average person go to find reputable research on the vaccines? I think we all have now access to huge amounts of information, both locally at the government site and also via the internet, that we can go and get information. And to the extent that we need information, speak to your health professional, because they will give you guidance. As I said just now, Bermuda is, I want to say, blessed to have a significant variety of healthcare professionals, and Dr. Carika, as being the scientist, a leading scientist on the island, from which we can get information. And it's just a question again of trust in that actual process. What I want to emphasize also is that we did receive notice that the government is going to have a press conference at, I think it's at 8 p.m. And we want to make sure, of course, that everybody listens to that, because ultimately that is the Bermuda source for factual information, normally led by the Premier, the Honorable David Burt, in association in the company of the Minister of Health, the Honorable Kim Wilson, and also the Chief Medical Officer, which they'll all bring information. I got a comment that actually the password was not working, but I think hopefully that's been resolved because we have numerous persons that have tuned in technically via Zoom, so that should be fine. So yes, let me just read directly what we received. That the Premier, the Honorable David Burt, the Minister of Health, the Honorable Kim Wilson, and the Chief Medical Officer, Dr. Oyelole, will provide a COVID-19 update this evening at 8 p.m., which you can watch on Facebook Live, YouTube, or on CITV. And again, that's one of those outlets whereby the government has been very good in ensuring that we get regular factual information and updates in terms of what is happening with the COVID-19. And so actually, I am going to, unless there are any pressing questions, there are persons that are present that are going to pass me any questions. And unless there are any pressing questions, I am going to ensure that we conclude earlier this day than normal, because I want to ensure that everyone has time to finish off whatever they're doing and give full attention to the broadcast. Just said just now, it's going to be at 8 p.m. with the Premier, Minister of Finance, and Chief Medical Officer. And for my constituents, in number 7, I want to say again that clearly my objective is to provide information to you based upon questions that you give to me, based upon things that are going on in the constituency, and based upon things that are just in the general interest that need to be conveyed to yourselves. Our regular contact number is 538-8683. You can call me on that number, or you can use WhatsApp, and WhatsApp is actually probably more efficient in terms of ensuring that I can be responsive to any questions or concerns that you may have. And the one thing I'll say, which is going to impact all of us, is that the trenching will continue currently along the Heritage Farm Road. We've been advised that the goal now is to finish the trenching, at least get to a stage whereby the trenching can be finished for December the 18th, with the road restored to allow persons to enjoy the Christmas, traffic-free or hassle-free, I suppose. But then after the Christmas holiday, they're going to restart. And I have asked and been advised that the trenching will then carry along Harrington Farm Road with the ultimate goal of reaching the Valco substation on Flats Hill by March 2021. And so I've already asked them persons to prepare themselves for that. They're going to obviously be road diversions to ensure there's a minimal disruption, but clearly we're going to have to all exercise more patience as we go through that process to assist or to allow Valco to make improvements in improving the infrastructure. We've also been advised that part of the goal is to work with government to ensure that water lines can be installed, because the government does have a plan, which has been announced already by the Honorable Colonel Birch, who is the Minister of Public Works, to ensure that pipe water can be provided island-wide, starting from Devonshire going eastward. And so, as far as I understand, that is also part of the plan. We're going to be doing lots more things for C7, and what I would encourage everyone to do is to stay tuned. You know that we do send out regular broadcasts by email, but you have the consistent contact for our Zoom, so you can always tune to that. As I said, you can call us and send me emails to a.richardson@plp.pm. Being passed another question. Again, as we prepare for the Christmas holiday, I want to encourage everyone to do something for someone else. That's going to be very important, because this is going to be a Christmas like no other for all of us. Number one, we cannot gather as we would like to, as we've done in the past, and so we have to be mindful. There are many seniors and others who are in our community that sometimes live alone and would like to just have someone say hello. And as you know, I intend to continue to be in contact through canvassing and other outreach. What we are doing is every first Saturday, we're going to be somewhere in the constituency. Our primary base is the park lot across from Harrington Dock on the first Saturday of every month between 10 and 12. But we're also going to be doing something a little different, probably in the new year, is to ensure that we are in the constituency in different locations, recognizing, of course, that the constituency extends from the Causeway at Blue Hole Hill all the way across to Harrington Sound and up and then over to Depton Hill. And so it's a very large, physically large constituency, and want to make sure that persons recognize, or that they know that we recognize, that the constituency is broad, and we will make sure that we are visible in all those locations. I will also commend and thank those who do stop by, because, as I said to our team yesterday, every time we do it, at least one person or a few people stop by and give us new information. Yesterday's information was that there are concerns, and it's not the first time, but there was a concern that there are too many persons traveling at relatively high speed along Harrington Sound, and they're trying to find ways whereby that can be contained or curtailed. Again, I know those comments are now more to the bulletin number 7, as opposed to the broad discussion that we're going to hear with Dr. Weldon. Again, Dr. Weldon does extend her sincere apologies. She has to assist and prepare and provide information, which is obviously more important for the national interest as opposed to the more narrow interest of Constituency 7. And I'm assured actually that she'll have provided input for the broadcast that will be done by the Premier, the Minister of Finance, Minister of Health, and the Chief Medical Officer at 8 p.m. And so with those things, I'm going to sign off for tonight. Again, I want to ensure that everyone now has time to finish what I'm going to do, and so we can all give good attention to the broadcast at 8 p.m. with the Premier, Minister of Health, and Chief Medical Officer. Do enjoy your Christmas holiday. Please keep safe, and please ensure we follow the guidelines that will be given by the government in terms of wearing masks, washing our hands consistently, and also on a personal level, make sure that we avoid confined spaces and we avoid crowds, because those are the times by which you are more easily able to be exposed to other persons who may have the virus, and then you may contract it. Within reason, the goal also is to treat everybody as if they have the virus, and that way you're more likely to govern yourself accordingly. And so I will say again, thank you. I want to thank you to my team that's here tonight. They very often don't want me to name them by name, but I'll assure everyone that we have a team now, a very big team actually, that ensures that we're able to do these broadcasts. And as soon as we are able, possibly before Christmas, we will have a broadcast with Dr. Weldon or another health professional to give more information in terms of where are we at with the virus, and to ensure and reinforce what the government is doing in terms of making sure that we're able to minimize the virus. So on that note, I will say again, thank you. Let us all tune in to the broadcast by the Premier, the Minister of Health, and Chief Medical Officer at 8 p.m. Thank you.